Hello everybody, good afternoon. Welcome to this webinar organized by EFNA. For those of you who are not familiar with what EFNA is, just a few words on who we are. We are the umbrella pan-European organization of European disease-specific patient groups. And as such, we represent a large patient community, many millions, in Europe. A few weeks ago, we discussed the impact of COVID-19 on the neurological community. And today, in this second EFNA webinar, we will discuss what will happen in the period ahead and how we can ensure that our voice as well is heard in the post-pandemic recovery and planning phase. I'm delighted to have a great team of speakers today from a variety of organizations, and we very much look forward to hearing their thoughts on what we can do and how we can cooperate. And very importantly, how we can make sure that neurology features prominently in the plans and agendas. So that by way of very brief introduction, I'm now happy to hand over to Donna Walsh, who will lead you through the afternoon. Donna?
Thank you, Yoka, and hello everybody. I'm Donna, for those of you who don't know me, and I work as Executive Director here at EFNA. And I'm thrilled that we have so many participants here today for our second COVID seminar. What we want to do today is to look more at solutions and next steps, particularly from an advocacy and policy perspective. But what I would like to do before we get to the discussion is to really give you an overview and a recap of what was discussed during our first webinar, and to think about how we can build on and learn from these challenges. So apologies to those of you who did join us first time around, if you're hearing this for the second time, but these really are a synopsis of the challenges that we are facing in the neurology community when it comes to the pandemic. So as you'll see, the first point is that access to medicines doesn't seem to be the big issue for the neurology patient groups. More so, it is access to services and supports. As many of you will know, those affected by neurological disorders often require multidisciplinary team support and care. And during the pandemic, there was a huge issue in terms of accessing these types of services, whether that was a rehabilitation center, whether that was a pain management clinic, whether it was a mental health service, and so on. And that is something that we really need to look at and ensure that access becomes available again for our community. The second point is around the infodemic that we have faced into. Some of you might be asking, what's an infodemic? It's a made-up word, essentially, which describes the proliferation of information that we have seen during this pandemic. The problem has been that much of this information has been damaging to the patient community. We've seen a lot of hastily put together, poorly conducted research that has actually been published in reputable journals. We've also seen a lot of dangerous misinformation filtering its way through social media. But for our community of neurology patients, we've seen a real gap and a lack of specific targeted information for those populations. And patients have been left to themselves to work out what is accurate, reliable, credible information and what's not. And for many patients, their first port of call have been the patient organizations, who are trusted partners in this way. But for patient organizations, they've had their own set of challenges. So whilst on the one hand, they've been seeing an increased demand for their services and for the supports that they offer to their communities, on the other hand, many of these patient groups have been confronted with hugely decreased resources, whether that's in terms of financial resources because opportunities for fundraising have really been affected, or human resources because charities and nonprofit organizations have had to let a lot of their staff go, at least temporarily. So this is something that definitely needs to be addressed. Research was also an issue that cropped up during our first webinar. Many of you telling us that clinical trials were stopped or were slowed down. We've also seen basic research suffer during this pandemic. So universities closed, laboratories closed, researchers were redeployed or trying to work from home in a new environment. And this is really an issue for neuroscience, where we are still trying to understand the complexities of the brain. And we really need to ensure that basic research is ongoing and continually supported. And the concern now is that when research restarts, that there will be a huge emphasis on infectious diseases, and that resources for our field may not be to the extent that we would like them to be. The social impact of the pandemic has also been something that has been put forward by our communities. A lot of patients and those affected by neurological disorders have been socially excluded during the pandemic, asked to stay home. And now, as our societies are opening up, as we're coming out of lockdown, a lot of these vulnerable populations with underlying conditions are still unsure when they can re-emerge into society, when they can go back to work, back to education, and so on. And we need to ensure that we're thinking about these vulnerable populations as we get our societies up and functioning again. Obviously, carers also fall into that bracket, and carers really have taken on a huge burden during the course of the pandemic. Often external carers cannot now come to the home. Respite care services have been closed down, and these informal carers who may now also be working from home, looking after children, looking after a relative and so on, have been working 24/7. And this is something that has to be recognized and has to be addressed. And this links into the point around mental well-being, not just of these carers, but also the patient community and society as a whole. What will be the long-term impact on our mental well-being as a community, and what can we do to address that? And the final point that really came out very strongly from our first webinar was how patient involvement seems to have died a death during the pandemic. So we had seen patient involvement, patient engagement over the last number of years really gaining traction, and the patient voice starting to be integrated in policy making, in decision making, in research and development. But during the pandemic, when we went into crisis mode and we set up these national emergency task forces to decide how countries were going to respond, the integration of the patient perspective was very, very low. And in some cases, it wasn't there at all. And ironically, a lot of the decisions that were being taken really impacted on the patient communities. So this is something I think we have really learned from the pandemic, and something that needs to be addressed when we move into the recovery planning phase, as is starting to happen now. Alongside these challenges, however, we've also seen opportunities. So it's not all doom and gloom, although there has been so many negatives over the last number of weeks and months. The upshot of this is now we see this increased focus on public health. More resources are available. We saw the EU for Health programme being launched very recently, and suddenly we're moving from a budget of 400 million to almost 10 billion, which is an astronomical increase in resources being diverted into the area of public health. And it's something that we never envisaged. I remember before the 2019 elections at EU level that we were thinking public health was going to be disappearing completely from the EU's agenda. We wondered, would DG SANTE still exist after the elections? Would there be a health commissioner? Well, now health is back on the agenda, but we need to ensure that neurology is part of that. We've also seen the acceleration of this digital transformation of healthcare. And on the one side, that's a very positive thing. But I think on the other side, what we've seen in this pandemic is we're not quite there yet in terms of the implementation of this agenda. So in terms of digital literacy, not just patients, but also healthcare professionals are clearly at very different levels. And it can't just be that we have a new digital technology or a digital therapeutic and we assume that every healthcare professional and every patient is going to take it up and use it in the day-to-day management of their disease. We also need to think about the fact that access to these technologies is not equitable across the EU. So in big cities, perhaps the connectivity is better than in rural areas, in high-income countries versus low-income countries. So who has access to these technologies, and could there be a real digital divide? I think patients too are still very concerned, and certainly we've heard that from our community around data privacy, data security, how some of this information could potentially be used. And that is something that we need to address. But certainly I think what this pandemic has provided us with is almost a pilot in terms of the use of these new types of technologies. And it's something from which we can learn and for which we can use to inform our plans in this space moving forward. We've also seen more innovation, more collaboration, and more flexibility, not just in research, but also in regulation and in reimbursement, for example. So over the years, particularly in the neurology space, we've been very vocal about the fact that clinical trials don't always work in the interests of patients. And we've been told, well, that's the regulation and there's nothing you can do about it. Or we've been asking, companies and other stakeholders to come and work together instead of in their silos, sort of competitive approaches. We've been told, well, that's the way business works. But what the pandemic has shown is actually these things are not immovable obstacles. And when necessary, we can actually be flexible. We can be innovative. And what we're hoping in our field is that we don't just go back to the way things were, but we start to think about what works well, and what could work well in this particular complex field of neuroscience and neurology. We've also had many patients talk to us about how these new models for care delivery and the new patient pathways that we're seeing could be a very positive thing. So lockdown really showed us that during the pandemic, our hospital systems just couldn't cope with a surge in patients. And this is often because those with chronic long-term conditions are accessing care in this tertiary setting and are working with specialists. If you talk to the patients, many of them would be much happier to actually have their treatment closer to home in a multidisciplinary community setting. And that could be supported by digital healthcare solutions or other types of mechanisms. And this is something we need to explore. Could changing the care delivery and patient pathways actually future-proof our healthcare systems and ensure that the hospitals are really only used as and when necessary, or in the case of an emergency like COVID? We've also seen more opportunities for patient and public involvement. Obviously during the pandemic, as I said, that sort of died away. But as these multi-stakeholder teams are now coming together to plan new instruments for finance, new types of research partnerships, new ways to deliver care, there are lots of ways in which patients can and should be involved, and we need to ensure that that happens. And the final point before we move on to the panel discussion is just to say, we know now that, it can be done. Things can happen in this space. In neurology, we have a long, long way to go. And what we've seen with the pandemic is when there is an acute emergency, the troops can be mobilized, the resources can be put on the table, we can all partner up and we can all spring into action. The issue we have in our space is that we have this slow burning crisis. We are seeing more and more people being diagnosed with neurological disorders. If you look at the latest global burden of disease study, we're talking about neurology being the leading cause of disability in the world, being the second leading cause of death in the world, and posing the biggest burden amongst all non-communicable diseases. At least 1 in 3 people will actually have a neurological disorder in their lifetime. And if you talk to our colleagues at the European Academy of Neurology, they will tell you that that's probably closer to 1 in 2. So we have an epidemic of chronic diseases with neurology at the forefront, with our aging population, with our lifestyle risk factors, with the environmental context that we live in today. And we really need that to be seen as the emergency that it is, because many of our neurological disorders were discovered in the 1800s or the 1900s, and 200 years later, we still have no cure. In fact, we don't even have optimal treatments for many of these neurological disorders. And we acknowledge that brain research is among the most complex type of research there is. But if COVID has shown us anything, is that things can be done well, things can be done quickly, things can be done innovatively and flexibly. And we need to learn from that and to try to apply that approach to what we're doing in terms of our advocacy for neurology and in terms of the policies and prioritization that we will hopefully see in this space. And that's really what our conversation is about today. We want to think about how we can position neurology centrally, how to have it seen as one of the healthcare priorities today, and how to ensure that resources are allocated in that direction. And that's why I'm really thrilled that we have such an esteemed panel with us today to discuss how we can really put neurology on the map and how we can really lead in terms of the recovery planning. So I will move to our panelists, and before I come to them with the questions that we have prepared, and some of you have already submitted, I will introduce you to each of them. So we have, first of all, Dr. Tarun, who is heading up the brain health team at the World Health Organization. We also have Nina Renshaw, who is the Director of Policy and Advocacy at the Non-Communicable Disease Alliance. We have Paola Barberino, who is the Chief Executive Officer at Alzheimer's Disease International. And we have Kasia Ptak, who is a Policy Officer at DG SANTE within the European Commission. So as you can see, we have a superb lineup of women to discuss this topic today. And actually, Paola, I think I'll come to you first to start with the patient perspective, because that is really where we want to center the discussion. And I just wondered maybe if you could tell us if the challenges that we captured from our first webinar were reflective of what you've seen within Alzheimer's Disease International, and maybe give us some insight in terms of how you've been trying to overcome those challenges and what sort of, I suppose, stumbling blocks you've hit along the way, but also what successes maybe that you've had to date.
Thank you very much, Donna. Yes, I think your first webinar obviously captured most of the issues that we have been seeing during COVID. We were quite fortunate because we work a lot with our Asian member, and we were very early in our response to COVID, and we asked the China in particular to teach others what their experience had been. And this brought very early to focus that there were some particular issues around the care. So from very practical problems, you know, how do you cope when people are approaching a person with dementia in a setting that is neither informal or formal, with families perhaps living intergenerationally that have never had to care directly without the support of social services, the lack of those social services, the challenges of having someone with a mask, for example, what do you do with it? You know, the kind of confusion that can happen. I still remember when France talked to us about people wandering in the street and being fined by the government. Taiwan had the same problem. They did intervention with their government to explain that people wandering in the street just was going to happen, and people would not social distance, and they had to consider that in their advocacy. I still remember with horror when I heard the first from the Philippines what was happening in triage situations when people were being, people with dementia and people, especially senior citizens, were being deprioritized in the use of ventilation. This is for the first time that one of the challenges you have not highlighted in your introduction came to the fore, and that was that human rights of people with dementia were being trampled pretty much all over the world. Now, we've always been very active in that area, but I think that this has opened the door for further advocacy and coming together. It was so great to hear you. You know, you stated so clearly the emergency of neurological conditions. Yes, probably 1 in 2 persons in the world is being affected. We got to be all together here, because this has really very much brought in sharp focus how unprepared governments are with the issues that neurology puts to us these days and age. We've had the challenges of all kinds. There have been also positive things. Telemedicine, which you have referred to as being one, has been used very effectively. Remote support groups in the absence of formal social care structures have been incredibly expanded. I mean, people were very hesitant about it, but they also have, again, highlighted a lack of accessibility, especially in lower and middle income countries, but also in higher income countries where people are in settings where access to IT is not there. So yes, amazing things can be done virtually, but also there is the worry that you are going to create yet another class of have and have nots. The reporting of data at the moment is one of our great concerns. We are trying to find data, some of your members may be able to help, on mortality rate for people with dementia during COVID-19. Very few countries, England and Italy springs to mind, they have published data which is shocking about the rate of mortality of people with dementia with COVID-19. But at the same time, we're trying to gather that more broadly, because again, it's going to be a fundamental plank in our advocacy in demonstrating just how vulnerable our base is. And I'm sure that EFNA in due course will be able also to contribute to that piece of advocacy. I think for all of us that work in this area, there's been a big issue around diagnostics. The second webinar we did about a couple of months ago highlighted just the scale of the diagnostic issues. Now, probably for 4 or 5 months, nobody has asked for diagnosis around dementia. What will be the consequences of that? And crucially, you talked about mental health and well-being. What are going to be the consequences for families that have no information, that don't understand what's going on in situations that are going to be rapidly deteriorating? So I've talked about data, and in general, I think what this has also shown to us is the level of solidarity. The same fact that you are inviting us to speak at this webinar with an audience which is more broadly concerned with neurological issues is so important to us. We need to be together here, because really this is the unheard voice. Other diseases are way more visible. Other disorders are way more visible. And I think the fact that the constituency of COVID-19 overlaps so strongly with the constituency that we represent gives us an awful opportunity, but yet an opportunity to bring that plight more to the fore of policymakers. Thank you.
Thank you, Paola. And I think Tarun might talk a little bit about what WHO are doing to address some of the concerns you've raised. But before I get to Tarun, I wanted to come to you, Nina, because you are working with the Non-Communicable Disease Alliance, which obviously includes mental health and neurological disorders, but also includes sort of a broader range of maybe more well-recognized diseases, as Paola mentioned. And I would be interested to hear from you, I suppose, 2 questions in one here. Are the challenges you're seeing across the NCD space similar to what you're seeing in neurology, or are there differences? And also maybe, you know, is there work going on in the NCD space more broadly that you think could help us to address some of the concerns that, you know, I mentioned earlier and Paola has reiterated since?
Sure. Thank you very much to EFNA also for having me and inviting NCD Alliance to be on the call this afternoon. So for those that don't know NCD Alliance yet, we're a civil society network. We're a membership network, and we also have around 65 national and regional alliances and over 1,000 member associations worldwide dedicated to the whole spectrum of non-communicable diseases. And both prevention and control of those diseases. So, I mean, the reason for our alliance coming together when we were constituted 10 years ago was a recognition that across the whole spectrum of NCDs, we could influence policies and programs much better if we worked together. That collectively NCDs had been kind of neglected in global health, and that there was a need to put these on the global stage. And over the 10-year lifespan of the NCD Alliance so far, this is something that we've kind of broadly achieved across the global political agenda. We've had 3 UN high-level meetings, so that means heads of state and government getting together to discuss NCD prevention and control. And there's a dedicated target in the UN Sustainable Development Goals for 2030 on reduction of premature mortality from NCDs. What we're really seeing now, I think, with the pandemic is a further improvement in political recognition that NCDs are and remain, you know, the world's biggest killer and cause of disability, and that they constitute, as you were saying, Donna, very correctly, a global health crisis in their own right that needs an urgent policy response and hasn't had it so far. And COVID-19 is really putting a rocket, we think, under that recognition. I think in terms of our work, we've seen an enormous appetite from the media and in the public discourse of information about NCDs. You know, you've got media on every continent on the planet suddenly talking about underlying health conditions. meaning NCDs. And it's widely understood that this includes a whole range of NCDs, so from cardiovascular, cancers, diabetes, respiratory disease, dementias, immune diseases, kidney diseases, asthma, I mean, all of the spectrum of neurological conditions included. So this is, you know, for the first time ever, I think people living with underlying conditions with NCDs are being recognized as a community that has something in common collectively. And I hope we're also coming to a recognition that that's a community that includes around 1.5 billion people worldwide. So it's a massive number of people. I think we're seeing this in journalists, but I think, you know, in our own experience, we're all talking to friends and families. Everybody's done that mental kind of scan of, you know, who among my loved ones might be more at risk from COVID-19 because of living with a health condition already. So there's I think, you know, a real global moment of understanding of what NCDs really are, and that this is one community that can work together. You know, we know that there are multiple layers of how the NCD community is being affected by COVID-19. So it's not just the risk of getting more severely ill if the infection is the virus is contracted, or dying from coronavirus itself, but also the disruption, as we were saying, the disruption of regular services, the disruption of diagnostics, the disruption of screening programs, and the disruption of regular and in particular face-to-face care. You know, and this is something that we're hearing across the community of people living with NCDs, and the WHO has done a really good job of pulling together a first rapid assessment of disruption to NCD services, which came out a couple of weeks ago, which reveals that over 3/4 of countries around the world are seeing significant disruptions, even total disruption of NCD care. There are some gaps in that assessment so far. So many neurological conditions haven't been included, dementia hasn't been included, regrettably, mental health hasn't been included so far. So there's more iterations of that study needed, but it's a really good starting point. It's been a really good starting point for us in our work to be able to go and speak to the media, for example, to make sure that this is on their agenda, and that recognition of the disruption of care is really widespread. And that this could be emphasized in our advocacy work as well. So in the World Health Assembly resolution on the response to COVID, which was adopted in the middle of May by global ministers of health, I mean, this really does have a strong recognition of the interplay with the prevalence of NCDs. And also, you know, governments have committed there to try and minimize those disruptions as far as possible. So this was, in terms of advocacy successes, this has been really important, because in the first draft of that resolution, NCDs were nowhere to be found, to be honest. So this is a bit of an indicator of what we're up against, and in the global health community, that we have to keep pushing to make sure that non-communicable conditions are recognized and are on the agenda at the real top level of government, and that we have commitments to tackle some of the problems that we're seeing. I think also it's really important to say, and Paula brought this up already, that, you know, COVID-19 is also laying bare a lot of inequalities in our societies and health inequities. We've got really very, very severe problems there, and there's a lot more that we need to do to learn from the lessons of this pandemic and build back better by tackling those inequalities. People who are very strongly affected, people are starting at very different starting points. You know, we're seeing the exposure of really deep racial inequalities. For example, data from the UK is showing that COVID-19 is proving more lethal for people from Black, Asian and minority ethnic communities. We're seeing very similar results for African Americans, very similar results for African Brazilians, for example. You know, there's disproportionate deaths and severe cases in poorer communities across all kinds of different societies globally. Where we're seeing data, there are certainly gaps in the data around that as well, but where we are seeing data, you know, we're seeing those inequalities really really exposed, and there's a much heavier price to be paid for certain parts of our community that we really have to address. You know, as we move from the crisis to recovery, we need to keep reduction of inequalities very much in focus and continuously bring this to the attention of political leaders and make sure that this is tackled in budgets going forward as well, that we've got some root causes of poor health, some root causes of underlying conditions, and NCDs, poverty, you know, gaps in education and so on, weaknesses in social protection systems, that we really need to act on to protect the most vulnerable communities. So yeah, I'm very, very glad that you've given us the opportunity to discuss some of these things in more detail today, but I'll leave it there for the moment. Thanks, Donna.
Thanks, Nina. There has been a comment as well on the Q&A asking if we can share that report that WHO did in terms of the rapid assessment of NCDs, and also more details maybe on the resolution that was discussed at WHA. So I think anything maybe that's discussed today we can collate and we can send to participants afterwards, which would be great. So I think moving on then, given that Nina, you've mentioned WHO a couple of times in your contribution to the discussion to Tarun. And I think what's interesting about WHO is the fact that obviously there is this division working on non-communicable diseases that has been hugely active during the pandemic. But also, Tarun, there is your brain health team, which has also been hugely active, and I suppose which is more aligned to sort of neurology more specifically. So it would be good maybe if you could give the participants a little bit of an introduction to the team, not just in terms of what you've been doing on COVID, but in general, because it's a new team and you have lots of exciting plans.
Okay, can you hear me now, Donna?
Yes, we can hear you now.
Great. So thanks very much and for giving us the opportunity to participate in this webinar. And indeed, as part of the transformation processes and the reorganization within the Department of Mental Health and Substance Use, where I sit, we are in the same division of communicable and non-communicable diseases. So together with NCDs, Mental Health and Substance Use is another department where a unit on brain health that has been created is to, the idea is to reinforce or re-energize the work that we have been doing in the area of neurological disorders and have a comprehensive approach to brain health. So it's about thinking about an integrated approach taking for the neurologic diseases, and because of the growing burden, and you rightly quoted the statistics, if you think in terms of burden, cost, deaths, they are very, very much high up on the agenda. So where do they stand in relation to the SDGs? How can we do it better in terms of the need that is for achieving the universal health coverage? And that's why this unit has been created. And it's about, and when we think about brain health, it is about thinking about from promotion to prevention to treatment, care, rehabilitation, not only for a person who has a neurological condition, but also for their families and caregivers, and which are equally important part of the agenda. You have, some of the work that we have been doing for, I mentioned here the work that we have been doing in the area of epilepsy, also with dementia, working very closely with Paula and ADI colleagues on the towards the implementation of Global Dementia Action Plan. And also on the other end of the life course in the area of neurodevelopmental disorders, autism. And so there has been much more ongoing. But the World Health Assembly this year, and because of COVID, all of those items were not discussed, but there was a report on synergies in addressing the burden of epilepsy and other neurological disorders. And I think that shows the importance and the mandate provided to the unit to take forward this area and thinking about that integrated approach. And when I say integration, it is about integration with NCDs, integration with mental health, integration between health and social care, and an integrated approach where it brings patient, families, caregivers together with the clinicians, researchers, and so that we can have a whole of society and whole of governmental approach to neurology conditions. So it's exciting times, and I think it's about also, as we think about this COVID-19, how do we convert that challenge into an opportunity going forward? So I'll stop here, Donna, and maybe you may have some follow-up questions, and I'll be happy to answer that.
Thank you, Tarun. And for anybody who wants to see that report that WHO has done on that rapid assessment of non-communicable diseases, Nina has just put the link in the chat. Equally, if anybody has any questions as we go through the panel discussion, do type them in the chat or the Q&A function, and we'll pick them up when we come to the discussion with the audience later. So Tarun, I think it was great to hear that neurology is certainly on the agenda at WHO, but coming back maybe to COVID specifically, can you tell us a bit about what the team has been doing in this domain, and also maybe if there are other things going on in other divisions of WHO that you think is relevant for this particular audience?
Right. So maybe I think let's couple of things on this regard. So one of the things, and you might have discussed this in your first webinar, was this, the evolving clinical picture and what we are learning about the neurological manifestations. And I think that's an extremely important point if you think in terms of encephalopathy or delirium or stroke or Guillain-Barré syndrome or meningoencephalitis, some of these neurological manifestations. The important part is that some of these are could be the presenting picture, even in the absence of respiratory symptoms. So I think that's important, is about the clinical care and the guidance. And there is the report on clinical management of COVID-19, and if the interim guidance, this was updated on 27th of May, where we have a chapter on management of neurological and mental manifestations now. So this is about the growing recognition of why neurological care has to be an important part of acute clinical care and support that is required in times of COVID-19. The second part is about what Paula already talked about, and also Nina, in relation to dementia and NCDs, that if we think about the pre-morbid or pre-existing conditions, and if you look at neurological conditions, amongst all the data that is coming after NCDs, it's actually the neurological conditions that are the commonest pre-existing issues, such as stroke or dementia. And so it's basically the enhanced vulnerability and the protection that is required. And so this is important part of the recovery planning that we are talking about. And I think one of the part of the recovery planning is not that it's over, right? We have to, there could be a second phase, in some of the countries globally are still undergoing, and we need to think about how do we protect the people with pre-existing conditions. The third part, which is very important, is about the disruption of services that has happened. So Nina talked about the significant disruption that has happened of service delivery for NCDs. We have actually launched a survey, a rapid assessment survey, similar to the lines of NCDs, and where we are asking Ministry of Health focal points on what do we know about the service delivery disruptions for mental, neurological, and substance use disorders. So this survey has been launched this month, and we'll have data available next month, and something that we can bring back to the community and share what we are learning about those in terms of the disruption of the services. So there is a WHO guidance on maintaining essential health services in terms of thinking about the outpatient care, thinking about inpatient care, residential, long-term care, caregiver support. So what can we do about it? The point also, Donna, I wanted to, you talked about the digital transformation. And I think right now, if you talk to anybody, okay, what you can do about disruption of services, use telemedicine, use digital technology, but not going into actually, what do we know about the evidence? What is the user acceptance? And there are also what kind of a policy change is required, what kind of issues around the reimbursement that we need to think about. So there are lots of issues that we need to think about going into if we are thinking about digital technology as a solution. And one of the things that I wanted to mention to the group, and which may be of interest, is that we have established a forum on neurology and COVID-19, where we have convened partners, which includes clinicians, which includes researchers, to facilitate sharing of information, knowledge exchange, and coming out with a harmonized agenda around clinical care, service delivery, and research. So we have established 4 working groups which are looking at these issues, and so something that we want to think in terms of what could be a harmonized and coordinated agenda moving forward in the era of COVID-19, what can we do now? But also, how do we use this as an opportunity for building back better for neurological care going forward in countries where there is huge treatment gap? So something that we would be very happy to share further information and partner with people who are on the panel, as well as the other participants.
Thank you, Tarun. And it's good to hear that that survey has been launched to assess the disruption in terms of neurological care, because there was concern, I think, from the community that it wasn't captured in that initial rapid assessment. So when that is ready, we would be quite happy to disseminate that to the community. Just before we move on with the conversation, I wanted to mention to participants that EFNA is participating in that global forum on neurology and COVID-19. There was a question that came in around whether patient representatives could get involved. So we are there. Just Tarun, is there any scope for other patient groups to get involved in that or at this point, or will there be opportunities ahead for that kind of involvement?
Thanks, Donna. So I think, as I mentioned, we had first few meetings with a few experts, that participants who came onto that forum, and there have been 4 or 5 areas that have come up. When I mentioned about this clinical care and support, and also, you know, if we are thinking about, let's take many countries in Europe, we have good infrastructure. It may not be the perfect solution that we are looking for, but it is good if you compare to many countries in Africa. How do we link up the physicians who are in a country, and when we are talking about acute clinical care that comes up? So some of the questions, for example, that we are raised is around these issues of drug-drug interactions and what to use and how do you manage that. So the second part that also has come up is about when we are thinking about the surveillance and epidemiology and data. And so one issue that come up is that how do we are capturing good information for neurology within the case record forms, and then how do we have harmonized this information and come up with a minimal data set? Because, you know, there is a research every day. You have more than 1,000 papers being published. So what do we do, and how can we do that? So that's something that we would be working on. The third part is about, and I talked about disruption earlier, so that's very important from how do we look into improving provision of services. And fourth is issue about the long-term impact. So there are speculations that this virus may be neurotropics, and so what needs to be done about it, and what kind of studies do we need to put in place. And the fifth part that I wanted to bring is about, you know, the advocacy that is very important, and I think that's where patient associations can play a role. And certainly we would be very happy to discuss with EFNA that how do we bring in these different patient associations. A last point I wanted to bring in here is the resources and the infodemic you mentioned. I think what I also feel is that we need to have this a kind of resources or a repository where people can find information, and it's not only for patients and families, but also for clinicians and researchers. And I feel the professional associations as well as patient associations can play a big role around it. And I've seen some things coming from World Federation of Neurology, European Academy of Neurology, but maybe, depending on the target audience, I think there is something also that we can do around this. So these are some of the ideas from our side.
Great. And I think as that sort of advocacy angle develops, that definitely you're going to have volunteers to get involved in that sense, and we can make sure that we keep our community involved in any of these actions that are happening globally. On that point, actually, Nina, I'm going to come back to you because, you know, from what Tarun has presented, we see that there is this stream of work happening in the area of brain health. There's a stream of work happening in the area of non-communicable diseases. But it seems to us from the outside that, you know, neurology has been excluded to a large part from the work on NCDs. Maybe that's because, you know, we have our own forum, and that, you know, is obviously fantastic. But we are very eager to ensure that neurology is integrated within the work on NCDs, particularly as we see governments in Europe, we see the European Union starting to sit up and take notice of the NCD agenda, the Sustainable Development Goal agenda. And unless we're part of that picture, our fear is that we will be sort of removed from some of the programs and initiatives and recovery planning instruments that we're going to see in the coming years. So a long-winded introduction to my question, which is, do you have advice for us as the neurology community as to how we can better integrate ourselves within that NCD agenda?
Thanks for the question. Yeah, clearly I think your concern is well founded, given where sort of the global response and the WHO response to NCDs comes from. There was always the 4x4 approach, as it's sort of colloquially known, so the focus on the 4 big killers within the NCD picture, so cardiovascular diseases, cancer, diabetes, respiratory diseases, and then the 4 major risk factors as well, so tobacco, alcohol, unhealthy diet, and lack of physical activity. And it's only very recently that that's been expanded to 5x5 by adding mental health and environmental pollutants, and specifically air pollution, with some integration of neurological conditions. And I would agree that it's absolutely insufficient so far, and there's still a lot more to do to recognize the whole range of NCDs and across the whole life course, across all age ranges, and the quality of life impact, as well as just the kind of very blunt figures around mortality and what's recognized as premature death at the moment, where the cutoff is seen to be sort of between 30 and 70 years. So we're cutting off the younger part of the age range and older people as well, which is certainly too blunt and isn't encompassing all the potential that there is for improvement as well. And I think we see a further major gap. These are 2 aspects that as NCD Alliance we're going to be doing a lot more work on through the course of this year and into our next strategic period as well. There's another big gap around research and policy responses when it comes to multimorbidity and comorbidities. That's another thing that's been really exposed by COVID, people living with more than one underlying health condition, which is, you know, increasingly recognized as the norm rather than the exception, have been seen to be, you know, exceptionally vulnerable. Specifically, the statistics from Italy in the early stages of the pandemic showed that just about half of people that were dying in hospital from COVID-19 had, I think, more than 3 NCD conditions. So, you know, there's a big gap in the research there as well. Treatment pathways, more holistic approaches where you're treating the person and you know, the combination of conditions that they may have, rather than just one condition or specialization in silos. So yes, we're very conscious that not only neurology but many NCD conditions are kind of caught in a vicious cycle, that there's a lack of data, which you've raised already, and arising from that a lack of political interest and a lack of funding. So, you know, if we're going to learn some of the hard lessons from COVID in particular, that really has to change. This is a point that we had certainly reached earlier, but COVID just brings that, you know, even more, crystallizes it in the public and hopefully political conscience as well. So breaking that cycle is something that we're really very much working on as the NCD Alliance, together with our membership that I mentioned earlier, and all the diverse communities that represent. What's been essential for us, what's been a real priority for us in our COVID response work, is bringing the voices of people living with the full range of NCD conditions into our work and making sure that they're being heard throughout. As I said before, there's been enormous media appetite for expertise and for lived experience. So I think that's something that civil society organizations and Paola's organization has been doing this fantastically as well. We can really bring to the fore the voices of people living with NCDs, people most affected by, you know, the prevailing health concerns of the day, health professionals, and especially carers whose voices are often missing from that discussion, as you've identified as well, Donna. We completely agree. So, you know, we certainly don't have all of the answers yet. I can definitely make a pledge to you that this is something that we will continue to work on, and we're increasingly going to work on, as I said, into our next strategic plan. So we'll be counting on our network to kind of co-develop that with us and make sure that we can bring that lived experience as much as possible also into our priorities going forward. I guess what we're clear on, again, as I was saying before, that the NCD community is much stronger together. and you know, there is, we don't at all want to say kind of, we told you so, but then, you know, the political priorities that we've been campaigning on for years, you know, all of this is really coming home to roost now. The failure to invest in universal health coverage, the failure to prevent NCDs as far as that's possible, the failure to invest in research, to know about causes, comorbidities, complications, treatment pathways, and so on. Like this is all really coming home to roost now. You said this is absolutely changing the political kind of pathways and political habits that we had before in terms of investment. And we're grateful to see that changing at the European Union level with, as you were saying, Donna, that 20-fold increased budget for the EU health programme is remarkable to see, but it remains a fraction as compared to the spending that's foreseen for other policy areas. And if COVID has taught us one thing, is that health needs to be integrated throughout the policy programs and the political decision making. You know, if we're pledging to invest much more now in the health response, then that's fantastic. But if it's undermined by unhealthy, let's say, decisions in other policy areas, then we're not seeing the big picture. You know, there's a lot more that we should be tapping into. And even in Europe, universal health coverage is still far from being a reality. It's not available to everybody equally. It's not available in all countries. It's not necessarily available for all health conditions where it's needed. And it's not available to all groups. As I was saying before, some marginalized groups may still be excluded from care across Europe. So we mustn't sort of take for granted that Europe is you know, best in class when it comes to universal health coverage. We've still got a long way to go across, also including prevention programs in UHC, screening, diagnosis, treatment, rehabilitation. We saw from the rapid assessment survey that rehab is one of the first areas of care that's being compromised for people living with NCDs during the COVID response. And palliative care as well. It was one of our advocacy priorities in that WHA resolution to make sure that palliative care would be well reflected and not forgotten during the emergency response of the pandemic too. So yeah, I mean, I suppose collectively what we still need is a massive mobilization for smarter investment in health. And, you know, we've been talking about it for 20 years already, but a genuine health in all policies response from policymakers. So we still have a hell of a long way to go to be where we need to be. So, yeah, yes, but, you know, very strongly convinced that working together and breaking some of those silos, as you said, there is a real risk that, you know, the political attention will swing and research attention will swing entirely onto communicable diseases and infectious diseases because of the fear factor, but there has to be a balance with the real burden of disease, which we haven't struck so far, and we mustn't swing further away from that. We have to recognize that the two are intimately connected, and that governments and other funders, whether that's private sector donors or philanthropies or overseas development assistance, for example, needs to reflect that better than it has done so far. So yeah, we know very well that the vast majority of global health funding is still going to communicable disease conditions. And, you know, we're trying to break down some of those silos. So financing and investment is also a key part of our work. And I think there's an awful lot that many of us can be doing in that space to make that argument as well for a better balance.
Thanks, Nina. I was interested in what you said around sort of the lack of data leading to a lack of political interest and then that leading to a lack of funding. And we had a similar conversation with some of our members yesterday about the fact that actually there's a lot of data out there for neurology, but the issue we sometimes have is that the field is quite fragmented and there are certain diseases that sort of grab the attention in certain countries and at different levels. And that, you know, maybe what we need to do as a community, and you alluded to this earlier, Paula, is to try to come together a little bit more and to make sure that people understand, you know, what neurology actually is, what the prevalence is, what the impact is, what the burden is on those affected. And before I kind of switch the conversation back to Europe, I did want to come to you, Paula, and I saw you put your finger up just to get your take on that, you know, what you've heard so far from, you know, the Non-Communicable Disease Alliance and WHO. and your thoughts, you know, from a disease-specific perspective in terms of how we can better come together and make sure neurology is included there.
So I think, thank you very much, Donna. I mean, we at ADI, as I said earlier, we work with everybody. I mean, we acknowledge the enormous contribution WHO is making, particularly at this time, as it's so tough to keep the pressure on the brain health stuff. And we work with NCDA, and we've done for many, many years. But the fact is that we are having a massive issue, because neurology and neurodegenerative disorder are really not understood. They're not understood by the wider population. People don't understand them. So when we published our World Alzheimer's report last year, I think possibly the most incredible result out of our survey of 70,000 people in 120, how many countries it was, in how many languages, 50 languages. What was most shocking for all of us to read was that 62% of healthcare practitioners, so nurses, doctors, don't understand that Alzheimer's disease is a disease. They just don't understand it. They think it's a cause of normal aging. So there is this issue that I think it's really important for us. And this is why at ADI, we're trying to use language which is easily understandable. So for me, joining ADI and understanding just how fragmented the policy discourse is under Sustainable Development Goals, universal health coverage, and non-communicable diseases, all of which the vast majority of the people in the world don't understand what we're talking about. And that is not working to our advantage as a cause, because we do need to get to the point that we have a brain, the brain gets broken just as much as the heart gets broken, the liver gets broken. This is an organ that gets broken, and we need to do something about it. And we can, in our lifetime, perhaps not, but we may be able to come to some solutions about this. We need to work with everybody, because we do. But for example, in the case of NCDs, is always a constant source of frustration, and Nina knows very well, and NCDA has been brilliant at trying to address our issues and bring our things forward. But more broadly, the predominance of certain diseases that have simply done better advocacy for longer, that's how it is, that's just where we are. It's made that particular debate less useful for us, less fruitful. And to us, because Alzheimer's and dementia are such a massive issue, and even the person in the street in the vast majority of countries is scared of them, they're worried. So everybody now understands it's such a big cause of death and it's such a big issue. It's almost like we've overcome it, because people directly understand that there is a problem and try and find directly for solution. So we try to work with everybody at policy level because it makes sense for us to do so. But we are also very aware that in a way the world is moving on, and this particular area, neurological diseases at large, and Tarun has rightly mentioned autism, you know, epilepsy, these are other big things that are worrying people that also we don't understand much about. So for us, it's about a point of making people understand about brain health. When WHO recently changed the way that they work to name it brain health, we were really happy, because effectively it gives much more focus on the brain. And this is where we're going to go. It's trying to explain to people, as also NCD is doing so effectively, that risk reduction also affects the brain. You can do things to keep your brain healthy as you can do things to keep your heart healthy. And that's why in the area of risk reduction specifically, we are having such good success with our work with NCDA, because really we're talking the same agenda here. However, we have to make, we also have to be clear that neurodegenerative disorders by and large affect the population when they are a little bit older. And that is something that also plays a part, because it's clear that certain diseases that affect people at a younger age, or the idea that you can reduce your risk better by adopting strategy at younger age, are not necessarily playing very well with the larger public. Some people give up. They say, well, I'm 50 now, so I cannot do anything anymore. And that is not true, and we know that. However, that is the perception that it's in the larger majority of people. And once again, our survey through evidence did demonstrate that this is a big problem. So it's also about us having strategy to understand this is not just about capturing people when they're very young. This is about us making an effort, family, multi-generationally making an effort. Now that COVID has shown us how multi-generational interaction really can play a part, also positive part, in dealing with some of the issues, we now understand that there is a lot more that we can do in targeting families. But it is difficult, and a lot of it is around public health. That's why working with an organization like EFNA, as any other organization that has a real interest in public health, with the European Union, we work a lot with every kind of regional mechanism. The WHO has fantastic regional mechanisms, for example. We work with WHO Europe, as well as all the other WHO offices. So every regional mechanism also can have and play a big part in the public health element. We need to say more to people so that they really embed this message. So there's plenty more that the conversation has really touched upon, some issues of incredible interest. It's been interesting to see also how many people in your chat box are asking, can we join this forum of WHO? Yes, organizations like us, of course, deal directly with the WHO and try to represent the interest of everybody, but we need more people also to come and tell us what do they want to have represented. We may be missing some points, some angles. We're always very happy to work with that, as is WHO, to open up to as many people as possible. And this opportunity, this virtual opportunity in a way, is consenting more participation. We have always looked at ourselves as a B2B organization. We are seeing increasingly that we are having a direct impact on people on the ground, and the movement is growing because of that. Thank you, Donna.
Thank you, Paola. And actually, it's really good to hear you reiterate that need for us to come together, because as EFNA, we represent almost 20 different disease areas within the neurology space. And it's always a challenge to find that common ground. But one of the things that we're actually doing tomorrow is having a first sort of messaging session with key stakeholders, so the European Brain Council, the European Academy of Neurology, to do what you've just said, to try to find those sort of compelling ways of explaining our data and telling our story so that it's understood by the man on the street. Because I think, as you say, it's so complex when you look at so many of these disease areas that it's not translating as well as it could or should be. And definitely, I take your point where we saw some really interesting infographics recently around, the impact of COVID as a little bubble, and then the impact of cancer and the impact of cardiovascular disease. But all the neurological disorders were shown separately. So, there was Alzheimer's, there was Parkinson's, there was migraine, there was MS. And I was thinking, why are they not shown together? Because we'd have such a huge bubble, it would dwarf everything else. And this is, I think, the crux of the issue that we need to try to get to. And I think with the initiatives we've just heard, there's definitely plenty of scope to do that. I realize we're already into the time for a panel Q&A, and I haven't yet even come to Kasia. So if people do have questions or comments, please do put them in the chat and the Q&A, and we'll integrate them in the discussion as we go along. But I do want to take the conversation back to Europe at this point, because EFNA is a European organization. And Kasia, I want to come to you as a representative of the European Commission to maybe give us a little bit of an update in terms of what's going on in Europe to really address some of the challenges that we've been discussing in the first part of this webinar.
Yes, thank you very much, Donna. Thank you for giving me the opportunity of joining this very interesting discussion. And sorry, I am not on the Zoom. I lost the connection and I cannot reconnect, so I will stay on the phone. Yes, indeed, we were very busy with the response to this COVID crisis. And as you can imagine, we had to put a lot of effort to address the emergency. So what has been done recently relates very much to the very rapid response solutions and measures. We've been doing our best, hopefully, to support member states who have been in the first line to fight this pandemic. That's why we've been trying to put in place some of the solutions, universal solutions, which hopefully were useful for them, Certainly, we managed to mobilize the efforts of our partners to, for example, solve the issue of deficit medical equipment, but we also issued many sorts of guidelines on public health, how to manage the crisis in the community, how to test, how to deal with testing, and so on. We issued many guidelines on how to manage borders and mobility during this time. And finally, we also, of course, support a lot the research for the treatment, diagnostics and vaccines. We are still not there. The emergency is still there. Nobody knows whether we can expect the second wave when and so on. That's why we need to get prepared for something to come. And next to this emergency, we also keep a close eye on the systemic challenges which we've seen, which became more apparent during the COVID crisis. And talking about the systemic challenges, I of course mean the healthcare system, how they performed, what happened to them, why even those systems which were reputed to be the best in the world actually demonstrated that there are some very systemic problems which should be seriously tackled in the future. That's why next to these emergency measures related to public health, we also put in place some measures to actually help the economy to kick off. And what you probably are aware, we issued the economic guidelines within the European semester, which have been approved by the Council on the 19th of June. And these economic guidelines actually place a lot of emphasis on health, on the resilience of healthcare system. Of course, they still put an emphasis on the mitigation of the severe consequences of the crisis, but also on the need to relaunch the growth in line with the green transition and the digital transformation goal. So this is on the table, and what is closely linked to this economic guidelines is also the mobilization of the EU budget to work towards these objectives. And this is really an unprecedented situation for the healthcare systems, because all the member states this year received the country-specific recommendation raising various issues, not only in relation to the emergency, but also and very strongly actually in the relation to the structural problems of health systems. And what we understand by the resilience, how we would like to encourage the member states to build this resilience, is not only in the relation to this pandemic. Of course, they need to probably improve the ways they deal with such crises, and this is an opportunity for them to do it. But they also have to address systemic issues. And there, of course, as it was mentioned, Europe seemed to be a good example for universal health coverage. But from our perspective, there are, of course, still gaps in access to healthcare, gaps in coverage, also all sorts of problems in accessing healthcare, huge socio-economic disparities, and the fact that actually non-communicable diseases cluster very much in these socially disadvantaged groups. So this is certainly a challenge which echoes on access to healthcare, but also on broader social protection policies and approaches. So this is, of course, one of the building blocks for us to have, addressing this kind of challenges is one of the building blocks to have more resilient healthcare systems. So access to healthcare is very high on this agenda. And what comes with it is also stronger funding. And it's not only the health program, which has a substantial budget now, but also it's still, this budget is still a fraction in comparison to the funds which are put at the disposal of member states. So there is a huge budget within the cohesion policy of 373 billion. There is also a new facility which is put in place. This is the European Recovery and Resilience Facility of 560 billion. So both will play a major role in putting in place the reforms in healthcare, improving the resilience of healthcare systems. And this has been taken into account during the revision of the proposal of the cohesion policy package regulations. So it's an important opportunity, I think, for member states to put it on their agenda. We also promote a different way of looking at problems in access to healthcare. We've started this work already before the outbreak of the crisis. So we realized that, as it was also mentioned here, that we don't necessarily have good data. We don't necessarily have a very good understanding of problems in accessing healthcare from the individual point of view. Our metrics is too much actually concentrated on the healthcare system. So. But the problems are not always there because this metrics doesn't actually measure the individual needs of each individual with all their complexities. That's why we put forward a proposal of changing the way we measure access to healthcare, and it's actually our ongoing work. We would like to see more patient approach in the way the metrics captures problems in accessing healthcare. That's why we are trying to put into perspective both social and clinical characteristics of patients to understand better what they need, what kind of services they need, not only in volume terms, but also quality, the way these services are provided, and so on. So it's on our agenda. We are working on it, and hopefully soon, quite soon, we will be able to share the report we are developing on that, and it will certainly provide interesting food for thought for the future, where we could actually consider scaling up this approach in closer cooperation with patients, with medical professionals, and so on, because this is also the idea which is behind. So we have also, of course, the big health program, and this big health program emerges, of course, as one of the lessons learned from the COVID crisis. Nevertheless, we will not lose the objective to support member states in their initiatives related to the prevention of NCDs. And this is clearly actually stated in the Objective 6 of the health program. And addressing the problems various patient communities raise, also you, is part of this project, because the Commission has been using and will be using a horizontal approach to support countries' actions on NCDs. Addressing all the determinants of health, promoting the implementation of best practices. This already has been done in the direct contact with member states within the steering group on promotion and prevention. And this approach will certainly continue throughout the implementation of the new health program. What is also critical, I think, is how to better use the health policy platform to structure, discuss, and convey the messages. This is actually very critical for the organizations as yours, I believe. In terms of other challenges that were mentioned, digital health, new models of care, mental health and well-being, research, integrated care, this is of course all taken on board in our funding proposals, both within the cohesion package, but also the health program will have some prominent priorities related to digital health, new models of care. So this is all, of course, taken account of. In terms of access to medicines, our recent initiative is the pharma strategy, which has been put in the public consultation, which is still going on. We try to draw some lessons from the COVID crisis in this strategy, but it also reflects more structural problems. I find it very interesting what your call to involve better patients. This is what actually working on the semester we've been trying to do in these recent years, because the analysis which is developed in the semester cycle takes into account the views of various stakeholders. Of course, we have to have good evidence. We are trying to get it. We are trying also to improve it. But we also talk to various stakeholders at policy level, but also with patient organizations. So this is indeed something which we value a lot because the dialogue with patient organizations indeed translates better the challenges on the ground. So we don't forget patients in this process. When it comes to new funding opportunities, a lot depends actually on how the operations are designed within the, for example, cohesion policy package. I think it's also critically important for you to be there and to ensure that the new solutions which this funds can support take into account the patient's views. It's critically important. On our side, within the health program, new health program, we will certainly plan to engage patients, especially in the actions we will develop on access to healthcare. So this will be certainly an opportunity to sit together, to have a closer cooperation, and to understand better your needs. So I think I can stop there. If there are any questions, I will be very happy to come in again.
Thanks, Kasia. I realize we're coming to the last 10 minutes or so of the webinar, and I'd like to come back around to all of you again just for some initial closing remarks before we finish. But I just had one follow-up to you, Kasia, on what you've just said. So clearly there are a lot of programs, a lot of initiatives happening at the European level. And I think maybe after this call, we can circulate a list of those and some links to further information to all of the participants so they could follow up. But one of the things I wanted to ask you is, although you're covering a lot of cross-cutting issues, I suppose my concern is that they will focus on infectious diseases. We've got the EU's Beating Cancer Plan as well, so cancer is very high on the agenda. We've seen a lot of happen in the area of mental health. Non-communicable diseases, excluding neurology, has been on the agenda of the Health Promotion and Prevention Steering Group. So my question is, how can we ensure that neurological disorders are included in all of these initiatives? And the second part is, how can we ensure that actually member states and regions and local authorities take up some of this work, and it's not just kind of left sitting there at an EU level and we see no tangible implementation on the ground. So the first part is how do we include neurology, and the second part is how do we ensure implementation.
Thank you, Donna, for your question. Yes, I think as I mentioned, it's very well. We've never excluded any of the clinical condition from our agenda, I think. And what will continue is indeed this horizontal approach to support the initiatives related to NCDs. I think it was not the intention to exclude one or the other condition from this agenda. And the opportunity to have your voice heard is like for any other patient community organization is indeed to use the health policy platform. This is how this dialogue happens. This is how you can discuss things and convey messages. This is how things get prioritized. So I don't know whether there will be any new mechanisms which will be put in place, because we are still in the logic of the treaty, where healthcare systems are the responsibility of member states. We are just there to support them. So so far, our discussion on the new opportunities of the new budget, new actions, has been structured around this logic of the treaty. We can come up with the support to member states. We cannot really replace them, impose anything on them. How to make sure that there is a kind of buy-in in member states? I think it's a very interesting moment now, where the discussion and the negotiation on the new cohesion package starts, and how this is being organized. I think that yes, there is a strong role to play by the assigned ministry. Normally, this is a Ministry of Regional Development. Of course, sectorial policies are taken somehow on board, and there is a huge variability of the solutions across member states. But I think it's an important moment for the organization like yours to come with the suggestions, with the proposals, to see with those who will actually decide on the operational programs, what are the opportunities for them. I've seen really in this last year a lot of organizations making a strong case. So I think it's really a good moment to do it, because in a few months' time, the opportunities won't be the same, because they have to progress on the negotiations. We have to finalize this process. Anyway, from our perspective, access to healthcare was put very high on the agenda in these negotiations. So it's open to any clinical conditions, if I may say it. We didn't put any restrictions or whatever. And we would be happy to see actually this money is spent in a very strategic way, really addressing gaps in access to healthcare where they really are. Really addressing the realities, and this is where we actually need our partners like you. From our perspective, we don't always see, I think, what the realities of a patient are. We are trying to understand them better at our level, but I think it's not so easy for us to put the national, subnational lenses to these problems. So I would just strongly encourage to to have your voice heard with the national authorities who are leading the process of the negotiations of the cohesion package. I think it's really a unique opportunity because health really got very high also on the agenda of the cohesion policy. There will be also this new instrument which I was talking about, European Recovery and Resilience Facility. So I think it's really a moment to have your voice heard at national or subnational level.
Thank you, Kasia. So we've only got 5 minutes left, and I'll hand over at that point to my colleague Tadeusz to close. But before that, I just want to come back to Paula, Nina and Tarun very quickly, because I think what Kasia has said is really interesting, that we need to try and influence from the ground up, whereas, you know, we're working from the top down. And what I wonder is whether each of you could maybe give us a very quick sort of 30 seconds insight or, you know, advice into how, you know, international groups like yours really can work with advocacy groups like ours to really work from the ground up as well as the top down. So Paula, maybe I'll start with you.
Thank you. So very briefly, there's been questions about also from your members on the Q&A. I've tried to answer one. We do work with national processes. So we work through our members, the members call us in and we work with nations. The only way is to work with nations. I think I agree with Kash. So it's very well to have regional bodies, but ultimately the change only happens at regional, at national level, even at local level. So we have to work with them. We are having a series of webinars. The next one is going to be on the 15th of July. I invite people who are interested to come and listen, because that will be around what are we going to do about national advocacy. I also would like to remember, Kash, that there is a lot of data that the organism like the EU may not know about it. We, for example, have data on the prevalence of every single nation. Some of it is real, some of it is extrapolated, but we can go to every single government and say, you have this many people with dementia and this is what's happening. And we use that, as Tarun knows, as Nina knows, at every possible opportunity. So we actually have a lot of data. The data exists. It's that the people are ignoring it, as you were saying earlier, Donna, very diplomatically. But the fact is that people are not taking it on board. And it's our job as civil society to make sure that our governments take it on board. And in part of that is to create a movement of people, of electors, that will put that pressure on national level. That's how I see it. Thanks.
Thanks, Paula. And we will, if you have a link for that webinar, we can circulate it to participants, because I do think...
Put it in the Q&A, how people can, but I think it got lost. So I might retype it in the chat.
If you type it, and if not, we'll circulate it afterwards.
Thank you.
Nina, same question to you. You know, how can we really work with groups on the ground? As EFNA, we're a pan-European umbrella of pan-European organizations, and this is really where we hit stumbling blocks. So any insights you might have on that one?
I would absolutely echo what Kasia and Paula have already said. So, I mean, that political response so far that we've been working on from our locations in Geneva and New York, yes, we have a WHO resolution on the COVID response, which mentions NCDs and commits countries to avoiding disruption of care, which is great. And there's a resolution in preparation for the UN General Assembly in New York in autumn as well. All this is all well and good, but we know, you know, from bitter experience that there is a massive gap between high-level commitments taken in the UN for WHA and so on, with what happens on the ground and what difference this makes to the lives of people living with NCDs. So definitely to reiterate the need for people with NCDs to be talking at every level of advocacy, so global, European, national, down to cities. We're seeing a lot of really promising engagement from sort of municipal level mayors and so on that are asking civil society organizations, what can we do? What's our role in this response, which I think is really promising. And we see some parallels there to what local levels of government have done in terms of climate change, where they've often driven the agenda maybe faster than the national government would be able to do. But yeah, we can't say job done until, the patient communities, the people living with, tell us that they're seeing differences in their daily lives on the ground. And for that reason, I think it's really essential for us as civil society, and WHO is looking at this as well, to really focus on galvanizing investment that we need. So investment in in UHC like never before. WHO is putting across really strong messages on, you know, UHC is the safety net to protect us against future health threats, which is absolutely accurate. And there's a lot of sort of narrative development that we can do together to tell our story about how we build back better, what that looks like. We, you know, there is political appetite and there's a lot of sloganeering around build back better, healthy recovery, which is great. But we need to flesh out, how does this look? What does it cost? What's the return on investment? What's the cost of inaction if we don't do these things, which undoubtedly, you know, we're getting a taster now of how massive it is when we don't heed these warnings. And in terms of making sure that this narrative is integrated into maybe bigger, more motivating agendas for the very top level of government, I think we're seeing now that the NCDs across the board are a security issue, and failure to invest is really putting security of populations, stability of economies, stability of health systems, resilience of health systems at enormous risk. So, you know, to take this up a notch and you know, not only be talking to ministers of health, but to be talking to World Bank, IMF, ministers of finance and so on, that we've really reached a crunch point, a crisis point for our health systems, and we're at a fork in the road where we can decide to do things completely differently in a way which speaks to citizens and speaks to voters who are disenfranchised on so many levels. But all of these, you know, protest moments and protest movements that we're seeing at the moment are very, very much connected to each other. And, you know, Kasia mentioned the limitations of the EU treaty as it stands at the moment. Well, you know, we're considering the future of Europe, the future of the EU. Should we not be considering whether stronger provisions are needed in the European treaty to be able to act more on health and have that closer connection to citizens and what they expect? So looks like really also exciting times in Brussels. You know, I was there 2 years ago, and the kind of opportunities now that I'm hearing to talk about these broader issues in Brussels and in the European Union, that was unimaginable 2 years ago. So, you know, credit to this Commission for taking this on, and let's see how far this can go, because it's not only about response to this pandemic, but it's about the threat of future potential pandemics. Foodborne diseases, climate change, you know, there's so much that we need to work on where the threat is intimately bound up with the population, the health of the population as it stands at the moment. So yeah, that fork in the road is kind of what I want to leave us with, and it is a challenge to all of us to figure out how we respond, but I'm glad we're having this conversation and everybody's thinking on it. So thank you again for having us.
Thanks, Nina. So Tarun, the last word before we close is yours.
Thanks, Donna. Just to add that if we look at some of the other conditions, for example, HIV, it has been the patients and the families who have been able to make that action. And so to add to what Paula and Nina have said so far, when we think about neurological conditions, I think it's not one disease versus an approach which includes both, you know, all the conditions. I think we need a mixture of those approaches, and something that neurology community can learn from what NCD did. So, and I think this is where we need all the community to come together and advocate as one voice to see that we are reflected much more in all the global agenda, all the regional agenda, all the national agenda. Then only we will be able to see that change happen. And it will not happen till we have that advocacy coming from patients and families. So you are going to be the flag bearer of any change that's going to happen. So with that, I give it back to you, Donna.
Thank you, Tarun. Throwing down the gauntlet to the patient community. And actually, that's a nice way for me to bring my colleague Tadeusz into the conversation just to close. Yesterday, I said to Tadeusz, we might only have 10 minutes left at the end. I'm afraid, Tadeusz, you've got 10 seconds at this point. But really what I wanted Tadeusz to do was just to give us, from your policy perspective, your thoughts on the discussion and, you know, where we as EFNA potentially might take this in the coming weeks and months ahead.
All right, I will try to continue. If it's breaking too much, then you just take over. So I'm cutting already to the half part of my notes because of the time, skipping some of the things. But I wanted to say that it's been really encouraging to hear today from the panelists on what's been a response to the current crisis, happening at various levels. So we have the global response led by WHO. There has been a lot of new schemes set up as a response of the European Union. There is, of course, a very important voice of civil society groups and patients. So I have a sense that while we recognize the challenges, we do recognize them, but we also see many opportunities that are now opening up. And it also seems to me that what is one of the key things at this point for a neurological community really is this recognition that has been mentioned by a few panelists. You know, we need to be recognized. It's a first step, recognized as a distinct disease area, recognized as disorders, recognized, you know, as a diseased organ. And basing on this recognition, we then need to have an acknowledgement of the disease burden, and these are really the first steps. And for this to happen, of course, we need to come together as patient groups of various diseases. So we've been really struggling, fighting for this recognition at EFNA, especially in the last couple of years or so. There has been some really positive developments at the global level. We had an addition of mental health and neurology in 2018 as the 5th very important NCD area. However, speaking of recognition, the neurology has been kind of hidden in the lines of mental health. So we really think that it's very important that neurology is kind of spoken out, not being buried. So this is something we've been trying to achieve. And an example would be last year high-level political declaration on universal health coverage, which initially only involved the mention of mental health. We then that was then distributed to the WHO Executive Board and many member states, and we were happy to notice that neurology was then included in wording next to mental health. And there has been also very encouraging developments happening after this. There is of course a brain health unit, but there was the latest WHO Executive Board where neurology in the context of epilepsy was discussed by member states, and as a result we have now a report that was issued ahead of the World Health Assembly by Directorate General, which really singled out neurology as.
Okay, we've lost Tadeusz again. So Yoka, I think on that note, maybe I'll hand over to you to close, and we can send some of Tadeusz's points to everybody afterwards.
This has been a really, really interesting meeting, and I want to thank first of all the panelists for sharing with us your results, your thoughts. We started off the afternoon by saying that we have a long way to go in neurology, and 1 in 2 people have a neurological illness, and what are we going to do? There was talk about solidarity and breaking down silos, which I found particularly of interest, and I think especially in the patient community, as Tarun said, it has to come from us, the patient community. We are the flag, what did you say, the flag bearers of change. I think solidarity there is going to be of the essence. We need to keep pushing to get on the agendas of the top level people and organizations, and partner with organizations as much as we can. We need to work towards getting prioritized as the neurology community. I think that is going to be of the essence in the coming time, because to me, what is really important, and it was mentioned today, we have a brain, and the brain is our most vital organ, and the world doesn't realize this. So we as a neurology community need to make it known that awareness of brain disorders is not only about dementia and epilepsy and MS, but it is about a multitude of disorders, some of them neglected, some of them even contested. But it is our job, our task to fight for that. And I really hope that with the help of all of you, we can achieve some solid achievement in the coming year, and with all the proposals that are going to be submitted within the EU system, I'm sure some of that will happen. So let me finish there. Thank you once again for your valuable input. Thank you, Donna, for moderating the meeting. And thank you everybody for listening and attending. We hope to be back at EFNA with more interesting and valuable webinars. Thank you very much.